Hello, my name is Dr. Zipporah Levi-Shackleford, and I am the founder of Creative Approach Development Center in Richmond, Virginia, where I provide behavioral supports as well as educational consultations to help neurodiverse individuals with creating goals that leads them towards independence and a higher quality of life so that they can live a life based on their personal preferences and interests and just be the best version of themselves that they can be. This is a presentation that I did for the ARC 2023 annual convention. It is titled Intellectual and Developmental Disabilities, or IDD, and Mental Health. And it's focused on promoting holistic well being for individuals with this dual diagnosis. So, thank you for joining me, and let's get started. So, as an overview, we will take a look at IDD, talk about what it is, some of the causes, and background about IDD. Then we will go into a discussion about mental illness to get a better understanding of that, which will lead us to a talk about dual diagnoses and understanding and defining what that means. We'll take a look at some of the common challenges individuals with the dual diagnosis experiences, and then we'll understand why this conversation is important and how to support those with the dual diagnosis. And I want to start out by sharing this quote from the poet Audre Lorde. It says, "It is not our differences that divide us, it is our inability to recognize, accept, and celebrate those differences." And this is a quote that I have always loved and I feel is very important for this talk because it is highlighting how our brains develop differently and how they operate differently. And a lot of times, because of those differences, um, people don't fully understand, and that causes a breakdown in communication and acceptance. So it's my hopes that by sharing this presentation, it will help everybody get a better understanding that we all operate differently, but that doesn't mean that either or any operation is better or less, and we should accept all. Starting out in the population of the United States, 1.6% has a diagnosis of IDD. That comes out to about 5 million people. So, again, this shows that this is a very important topic, even though we don't traditionally see this population highlighted much, in media and in resources. 5 million people is a lot of people, right? So it should be talked about more. And that's why I'm so appreciative of organizations like the ARC of Virginia and the affiliate chapters in the ARC of the US that really puts an emphasis on this population of people and the importance of getting a better understanding so we can develop more resources for them. So, what is IDD? So, IDD is a disability. It stands again for intellectual and developmental disability. And what it means is that the person has significant limitations in their intellectual functioning and adaptive behavior. Your adaptive behavior are the different skills related to pretty much like your daily living. So, for a person with IDD, we're going to see some limitations and delays in this area. It's a lifelong condition that starts during the developmental period. And the developmental period is when we're developing in utero, right? So it starts very early in our lifespan, and there is no cure for it. You may put some therapies and supports in place to address some of those limitations and deficits, but there is no cure to remove the diagnosis. All right. It is a lifelong diagnosis. And then the significant limitations in those adaptive behavioral skills, it often leads to a limited amount of personal independence. So these are some characteristics to look for in the definition of IDD. So, what causes IDD? As you can see from this screen, it's a lot of different causes. It can come from an infection that the mom may have had during her pregnancy or in early childhood. It can be related to some nutritional deficits, So chromosomal abnormalities like your trisomy 21 Down syndrome or trisomy 18. It can come from the environment. So, depending on the situation, exposure to lead or other harsh environmental conditions can lead to a diagnosis of IDD. Toxic intrauterine exposure, inherited genetic and metabolic disorders. So these are different conditions that are passed down from generation to generation. Trauma can lead to a diagnosis of IDD. And then there's a category called unknown, which means even though we have all these other categories here, there are still people who have a diagnosis of IDD that do not fall in any of these categories, and they therefore fall into this unknown cause group. And surprisingly, out of all these groups, the unknown group is actually the largest group for causes for diagnosis of IDD. So I thought that was pretty surprising because again, it's so many different categories and causes. So for those with IDD, there are some common challenges. One of the most noticeable would be the ability to learn and comprehend information. Expressive, meaning sharing what they have to say with others, and then receptive communication, understanding what's said to them. They're being able to complete daily living skills, socializing and integrating and interacting in their community. There's often challenges related to their physical health, the executive functioning skills, which are those related to your problem solving and organizing, time management, memory, all of that falls in your executive functioning skills. And then transitioning, moving from one activity to another or one environment to another. So these are different areas in the person's life that we will often see some deficits. So, switching gears, now we will talk about mental illness. Um, Mental illness is a condition that starts in late adolescence and early adulthood, but it can happen at any age, but it's more likely to get a mental illness diagnosis in those later adolescence years, which is different from IDD, where you're usually getting that diagnosis very, very early in adolescence, or even, like I said, prenatally, before the person is born, that diagnosis um, may be noticed, like with your chromosome abnormalities. Um, so, with mental illness, you will see that there is a consistent challenges in the cognitive or understanding, the way things are perceived, even behaviors, how the person interacts with their environment. And it can be changes or abnormalities in one of those categories or in any form of combination of those categories. Um, with mental illness, it's different from what you may hear mental health problem. So, a mental health problem is a change in one of these categories, but it usually lasts for a period no longer than 6 months. All right. So, if somebody has some kind of major change in their life, you may see something like an increase in anxiety or depression, but it usually occurs and then peaks, and then you see the person starting to get back to their baseline levels within that 6 month period. With mental illness, the symptoms continue on longer than 6 months. So, just wanted to share the difference between a mental health problem and mental illness. Mental illness is a more long term condition. Um, and then, like I said, with the onset, it usually occurs like in that later adolescence period. Also, with mental illness, as a difference from IDD, there can be a cure for it, meaning with therapy and often with medication, either by themselves or in combination, as well as some other support strategies. It is a possibility that the person can get more to that baseline level. Whereas again, with IDD, there is no cure for that, right? They're always going to have that diagnosis because of the different impairments that they have. Um, and research is showing that most of the mental illness diagnoses are biological, and the conditions actually changes the way the brain functions and operates. So some interesting information about mental illness, causes for mental illness, and then, well, before we get into the causes, talk about mental health and mental illness, because again, we hear these two phrases used often, and a lot of times they're used like they mean the same, but they don't. They're different. So your mental health is your overall well-being, right? It is your mental state, and it is your typical well-being of your ability to function and interact with your environment, whereas mental illness is a specific condition or disorder that interrupts that baseline of your mental health and leads to a diagnosis and often, treatment or some kind of intervention to help the individual get back to a functioning level. So it is a difference. Like I said, even though you will often hear the two used like they mean the same, but they don't. And then, like I mentioned before, a mental health problem is a disruption in your mental health, but it does not last more than 6 months. So it's more short term than what your mental illness would be. Causes of mental illness. So there are multiple causes of mental illness, just like with IDD. So it can be the environment. Um, Again, major life changes, substance abuse, consistent rejection from others, any type of abuse, whether it's physical, emotional, sexual, or verbal, a lack of nurturing and the right developmental supports during childhood, and living in poverty is something that can lead to a mental illness. It can be biological, if the family has a family history of psychosis, or again, related to the type of health and safety that the mom was exposed to while she was pregnant. It can also come from just basic neurodevelopmental changes or abnormalities. It can be psychosocial factors like your poor coping skills and poor social skills. It can be communication problems. So, these are three of the main areas or main causes for mental illness. And just going back quickly, if we look at some of these pieces on these lists or in these categories, such as the poor coping skills, poor social skills, rejection by others, um, having challenges with dealing with major life changes, we see that a lot of these fall under the definition of IDD. So that shows you why it is very common for somebody with IDD to also have a mental illness diagnosis. So, going back in summary, is there a difference between IDD and mental illness? Well, yes, right? So, with IDD, again, we're going to see that below average cognitive ability, which is the ability to learn and to understand. But with mental illness, there is no effect on the person's ability to learn. We may see some changes related to memory and maybe even processing because of the stress the brain is under during mental illness or with mental illness, but it's not affecting that intellectual level. With IDD, again, it occurs before that diagnosis comes before adulthood. It's lifelong, so there is no cure for it, despite what some groups share. There is no cure for a intellectual developmental disability. With the supports, they are mostly focused on trying to address those different deficits. So it's including more of training and skill development rather than medication. Um, and even, basic therapy, which with trying to understand emotions and stuff. With IDD, it's more of that skill development to address those different deficits. With IDD, we see impairments in social skills. Um, and the behavior is typically rational. So, despite again what we often see in the field with IDD, there usually isn't behavioral challenges. The behaviors are typically rational. You may see some activities described as a maladaptive behavior when it's really the person interacting with their environment with the deficits they have related to IDD, so not truly a behavioral challenge. And then IDD typically is not psychiatric in nature. Now, with mental illness, again, it does not affect the person's ability to learn or comprehend, but it does interfere with the thought processes or the way things are perceived, as well as emotions. Mental illness can occur at any age. Mental illness is something that can be temporary. It can be cyclic, meaning it has different phases, or episodic. It can be cured with the right supports. Now, this is not saying it's going to be a quick process, but it is a possibility that with the right um, therapy and medication, we can see a cure or return to baseline. Mental illness does not always impact social skills. And then with mental illness, we're going to see more of the behavioral changes. So we will see behaviors that can fluctuate. So more irrational. They may be normal, and then all of a sudden we may see an increase and almost like a manic, or a decrease more like a depressive state. So those are some main differences between IDD and mental illness. So, like I mentioned, when I talked about the causes of mental illness, and we looked at that those different categories and then the listings underneath those categories, and I pointed out that several of the specifics in those categories were the same as challenges a person with IDD experiences. And because of that connection, research shows that a person with IDD is 2 to 4 times more likely to have a mental illness than those in the neurotypical population. So, those with IDD, if we have a group of 10 people with IDD, 2 to 4 of those people with that diagnosis are going to also have a diagnosis of a mental illness. And then if we had 10 people um, without IDD that falls into that neurotypical population, we would maybe see 1 or even 2 of them with a mental illness. So it is a difference. It's more likely to have mental illness if you have IDD. And then going back to that statistic about the 1.6% or the 5 million people across the country that have a diagnosis with IDD, another study shows that 44% of that population um, may also have a mental illness. So, just some more statistics to show how prevalent dual diagnoses are. Again, to bring more attention to it, because unfortunately, even though it is so common to see, we're not seeing the supports and the resources out there like we need to. So, again, why is mental illness so prevalent in the population? Well, because a person with IDD is more sensitive to stress. And when we look at the typical life for a person with IDD, they're often put in situations that lead to stress. So, constantly meeting new people as far as support staff and people in different programs that they may be enrolled in, and doctors and nurses as part of their care team. Changes in schedules and plans. It's very common for a person with IDD to have spontaneous changes in their schedule, that they have to just quickly adjust to. And then, because of the different deficits that the person with IDD experiences, they're often being faced with somebody trying to help them learn something new. And learning something new is a stressful challenge. Um, People with IDD are often extremely dependent on others. And this can lead to stress because the way that, especially now with this current job market, it's a large turnover, so they may be working with one person and get to used to that one person's ways of support, and then all of a sudden they have a new person, um, feeling like they're a burden because they have to rely on others so much, especially when it comes to peers and family members. And then also recognizing and feeling the frustration from support persons with requiring so much help. The challenges with the interpersonal skills leads to the stress. And in a study, it was reported that 50% with IDD and mental illness felt a feeling of loneliness. And then, with the interpersonal skills, they often challenge having a balanced relationship, as far as the give and take goes. It's often one sided, which, leads to different challenges of their own. And then the challenges that they experience with coping skills, um, to help them get through those stressful situations related to, meeting new people and changes. And then the lack of those ADL skills and those executive functioning skills, which limits independence. So these are just some reasons why IDD is so common, or mental illness is so common with the IDD population. All right. So, what are some signs that a person with IDD has a mental illness? Well, we're going to notice that there is a need for instant gratification and fulfillment. We're going to notice a heightened emotional sensitivity, changes in sleep patterns. Often we see changes in like anxiety levels, or having more fears and phobias than usual, more panic. We can see more moodiness and agitation, an increase or decrease in appetite, changes in personal hygiene and appearance. That's a big one. Um, Especially if it's a person who traditionally is recognized for putting a lot of time into their appearance, and then all of a sudden you notice for multiple days they don't have that same, passion about how they look. That's a big indicator that something might be going on. Isolating themselves. If we see an increase in the self injurious behaviors, and the increase can be from 0 to 1, or it could be, oh, they only occasionally did it, but now they're doing it more. More talk about, people being better off without them being there, and other forms of suicidal ideation. And then the sadness that lasts for an extensive period of time. And when you try to talk to the person about it, they can't really pinpoint what it is that's making them feel this way. And then, of course, a big one, if there's a family history of mental health problems or mental illness, um, that's a good indicator that a person with IDD may have mental illness. So, when we put the two together, IDD and mental illness, that's a lot to say. So, the official term, which came about in 1977 by Dr. Frank Lacino, I always struggle with his name, but the official term he came up with is dual diagnosis. Um, Now, if you pulled out your phone right now and typed in dual diagnosis to try to find more information, you may notice that things will pop up. But then when you start reading about it, it's not talking about IDD and mental illness, it's talking about mental illness and substance abuse. And that is because the term over the years started being used more to reference mental illness and substance abuse. So if, excuse me, if looking for resources and information on dual diagnoses, just read it a little bit to make sure it's the right one. Because again, there's a lot of times where you'll come across the resources and you're like, oh, yeah, this looks good. And then you get into it and it's more about substance abuse. And then there's a lot of people in the field that don't really like the term dual diagnoses because they feel like it's misleading, and it's saying that the person only has two diagnoses when there's, often more than two. But um it's not saying that. It's just focusing on the IDD and mental illness being more linked together. So, for people who have a dual diagnosis, we often see that difficulty focusing. That paired with the challenges with comprehension, we can see where some additional problems will rise. The difficulty with remembering, understanding abstract concepts, which is something which is challenging for a person with IDD typically anyway. The challenges with being able to come up with or go along with a plan B, perseverating on things, so it's something that's, over and done with and happened, but they're constantly going back to it like it just happened. Increased challenges with transitioning, having a hard time accepting different explanations or outcomes. Again, social isolation and rejection by others. Another big one that I often notice is that low self-esteem and low self-worth, and that is a biggie. Um, and often when I'm called in, the teams want to focus on the behaviors. But I'm telling you, if we don't address that low self esteem and low self worth first, it's very hard to um, work together to develop a new strategy and system for that person and then to stick with it. Because if you don't have a good opinion of yourself and feel that you're worth it, are you really going to invest all that time and energy into change? So that's often a biggie. And I recommend, if you recognize that, jumping on addressing that first. Because if you don't feel like something's worth working on, you're not going to be invested in it. I'm telling you. We'll see increased helplessness and dependency, not so much because they can't do it, but it's just feeling like they need to have that additional support to get through the situations. The increased impulsivity, to the point where maybe they're engaging in activities they've never engaged in before, like stealing, um, or just acting before thinking. Sadness, depression, and withdrawal. Again, a lack of belief in self, looking for others to solve problems, so not even attempting it or not even trying to work together. And then difficulty to focus when things are hard. So, when we have a person who has a dual diagnosis, these are just some of the characteristics that kind of stick out the most for that population. So, why is this topic so important? Well, it's important for several reasons. One is related to medication. And when we look further into that, we'll see that people with a dual diagnosis usually have at least one kind of psychotropic medication that they're taking. And I bring that up because with the psychotropic medications, we need to be mindful of side effects, right? And if we have a person who has a communication challenge or who is struggling with introspection, which is the ability to check in with yourself to see how you're feeling, so you're able to check in with yourself and realize I've been sitting in this position for a while and my leg is falling asleep. Let me shift. Or, oh, that pain in my stomach means that I'm hungry. Um, Sitting in this room makes me feel kind of anxious, right? I'm just sitting in this room waiting and I'm starting to feel nervous. All of those are examples of introspection. And with dual diagnosis, that's a skill that is a higher level skill that is often impaired. So, if you're taking these psychotropic medications that often have a lot of side effects, are they able to express how these medications are making them feel, whether it is a negative side effect or if it's making them feel better? Um, so it's a little bit more difficult to get that information of how the medicine is doing for them. um, Sometimes you can get information by asking and providing some supports with checking in, but it's often something that's not even thought about, right? It's just like, here's your meds, take it, and it is what it is. um, but then on the flip side, we see that people with just IDD are often prescribed a psychotropic medication. 29% of that group often have a psychotropic medication, but no mental illness diagnosis. So I bring this up because if we have a psychotropic medication, we probably should have a diagnosis, right? So this is just something to bring up in conversation if you notice. Um, and it's a way to advocate for the person to make sure that they're getting medication that they need. And if it is recognized that it is a mental illness there, well, then we need to make sure we have all the supports that the person needs to um, function with this diagnosis, not just have medication. That's another thing. A lot of times they're prescribed medication, but we're not seeing the therapy side of it. So that's another reason why the topic is important, and especially looking under the medication umbrella. 70% of people with dual diagnosis are prescribed a um, mood diagnosis medication compared to 70% of those with just IDD. So, again, just being mindful that this is a category of medications that's often prescribed. Again, we got the side effects and stuff with that. Is this the accurate medication for the person? Should they be on something else? um, and just helping them check in, and also keeping in mind that the effects of medication can vary, right? It could start off really good and then it can start to wane. So teaching the person how to check in with themselves, um, and report any changes or challenges they're having with medication, and then having that communication with the prescribing physician to get a better understanding of what the medication is supposed to do, how it's supposed to help, and what to look for to see if it is effective or if it's not effective, so that you can constantly be in communication to make those changes. And a medication may be very effective, but then, if the person loses weight or if they start a different medication, um, it may not be as effective, or it may have a different result. So, again, having these communications and teaching the individual how to advocate and ask these questions to get a better understanding of what they are taking and how it is helping them, and to base whether or not it is. It's an important topic when we look at housing and employment. So we know that housing and employment for people with IDD alone is a challenge, right? Many live either with family or they live in a supported living situation, whether it be a group home or sponsored living. Um, but when we look at the dual diagnosis group, we see that 39% of them are living in a group home compared to just 26 with those with just an IDD diagnosis. Okay. And we look at the next statistic, people with dual diagnosis are 15% less likely to live at home with family compared to 38% of those with just an IDD diagnosis. So, what this is showing us is those with a dual diagnosis have a harder time living at home with family members. And again, that goes back to the level of supports and the different challenges that goes along with mental illness. We can get an understanding of why a person with a dual diagnosis may be less likely to live with family and live more in a group home setting. And then when we look at work, only 22% of individuals with a dual diagnosis are able to get a job. And then, the IDD alone statistic really isn't much better with 27%, but it is still about 5% more of those with just an IDD diagnosis that can get a job and are out there working. So, just some more statistics to take into mind. So, now we are going to look at what to do if we recognize that a person does have a dual diagnosis. So, like, what can we do to help that person? Well, one thing is we can help them with finding therapy and resources. Again, with mental illness, it's effective to have medication, but the therapy is important as well, and it's something that's overlooked. Therapy is a good way to learn about those experiences that happen that may have been difficult to deal with. It's a good way to understand what the person is feeling now and um, to get help with processing that. And it's very important to start at that level because, again, often when the different challenging behavior comes about, it's requested that a behavioral support come in to address those behavioral needs. Well, without the person being able to, again, engage in that introspection piece and identify what they're feeling and why they're feeling that way, it's really hard to um, teach coping skills in a way that they're, learned and then generalized across environments and situations. So, working with that mental health therapist to get a better understanding of that background and then of the present feelings so that they can start with the healing process, and then when they start working with the behavioral supports, can um, learn the coping strategies and then be able to say, I use this coping strategy when I'm feeling this, and I use that coping strategy when I'm feeling that, versus just calling in the behavioral supports and then they're being presented with, here's your coping strategy. And then it's kind of like, I don't know when I need to use them or whatever. So, highly recommend one of the first steps is pairing them with a mental health professional to help with that process. And then when they do start working with the therapist, there is the patient um, provider confidentiality, but trying to advocate for that person to be successful in therapy. So maybe working with the individual to come up with like a one pager or a list of events and topics that they want to discuss with the therapist to help with leading the sessions. So it's not just a traditional session format of coming in and unloading, which is something that a person with a dual diagnosis may not be able to do without prompting. And then a traditional mental health therapist may not be used to providing that level of direction and guidance and support for the communication. Finding a therapist is I often describe it as very similar to dating. It's not a one size fits all, and it's not an immediate match, right? So it takes time, and don't be afraid to ask the person you're supporting how they like the therapist, um, how they felt with the therapist. Do they feel comfortable? And if not, finding another therapist. So please do not settle for yourself or for the individual you're supporting with the first therapist that comes along, unless it is a good fit for you. But if you don't feel comfortable, then it's probably a good idea to switch, because the purpose is to be working with somebody who you feel listens to what you have to say, respects what you have to say, and doesn't judge you, but then also can provide some tips and direction on how to start healing or moving forward from the point you're at. And I did not mention earlier, but I am actually the secretary for the Arc of Virginia. Like I said earlier, I absolutely love the organization because of the level of advocacy, supports, and resources they provide for the community. And one of the big resources that the ARC has been sharing for individuals with IDD is Quillo. And to demonstrate how awesome the Quillo app is, I have included this video that I hope I can get to work. Uh-oh. Okay, I will pull up that link to this video. But it's a short video from a self advocate that talks about what you need to do to find a therapist. So, you can go on the Quillo app and just type in anything, and you will find these short little 60-second videos from self advocates that explains um, the different challenges and stuff that they have and how to, just do things and live life. So awesome app. And one of the videos they have is about finding a therapist. Um, Okay, so that's step one. Step two would be help them with identifying their feelings. So, again, we have the therapist on board, but this is also something that you can do to support the person with IDD. And I will share one of my favorite ways to do this is by just watching television with the person. So, another thing that I didn't mention earlier is that I am also a parent of four children, and three of my children are on the autism spectrum, and my youngest also has a um, rare form of Down syndrome. So these are strategies, and along with this, they have different levels of anxiety and depression, and some other mental illness diagnoses. So these are steps that I use not only professionally but also personally. And the strategy that I absolutely love and I use again personally and professionally is just watching TV with the individual. And then while watching TV, just kind of pointing out what's going on and how that person may feel, and using that to open up conversations about emotions. So, for example, looking at SpongeBob, right? Everybody loves SpongeBob. And it may be that he is going through some kind of challenge or he's getting frustrated with something. And I'll just simply, while we're laughing at it, be like, oh my gosh, he really seems frustrated, right? So this is a way to introduce not only your basic, happy, sad, um, tired, you can also introduce those other feelings as well. Oh gosh, he really seems frustrated. He really seems confused. Have you ever felt like that? Oh, if that was me, I would, and then you insert how you would deal with that. But these are really good ways to help with identifying feelings. And also, when you're noticing that they are expressing these different emotions, talking about it then. You seem really excited about going to King's Dominion tomorrow. Oh my gosh, when I get excited, I get these like butterfly feelings in my stomach. Do you have that right now? So, these are good ways to kind of start teaching about how to check in with yourself and how you're feeling. Create a supportive environment for them. Very, very important. And when I mention this, a lot of times people are like, well, she has her room. And that's like cool, right? So we want to have like the person's bedroom as their safe space, but also thinking about other places they may be, especially if it's on their daily schedule. So if you work at a day program, maybe having a area where people can go to just kind of reset and recharge and have some resources there to help them with the process, whether it's a visual that talks about deep breathing or, the chart about emotions or whatever. Just, having these different environments for them to check in. And then seeing how they're doing and if they're still effective. Again, we change, right? So it may be that right now my bedroom is a really safe space, and when I come, like soon as I walk into my bedroom, I feel chill. But then I don't know, 6 months later, I may walk in and I just feel kind of overwhelmed by the way things are. Like I start feeling like everything is everywhere. So again, remembering that there isn't really a strategy that's going to be effective for the rest of the lifespan, and checking in to see what may need to be changed. Learning the patterns. So taking some notes, um, and jotting them down. And then you can use this as part of that cheat sheet when, you pair the individual with a therapist, or when you're going in for med checks. But it's a good way to recognize that there are ups and downs when it comes to really everyday life. And that has to do with our mental health, our mental well being. If you do start noticing certain patterns, you can kind of get ahead of them and come up with some supportive strategies and environments for any of those um, areas in the pattern that may be more challenging. So, you might notice that towards the end of the month, this person really seems to get more into a depressive state. And if that's the case, that third week of the month, you can, maybe include some more activities to, keep them motivated, and then have additional supports that last week of the month to comfort and support them through that depressive stage. Educate yourself and them. So, really important when you have a diagnosis to just learn. My favorite learning platforms is YouTube. And I love it because there's so many self advocates. TikTok is really great too. Um, but educating yourself about the different conditions. And I highly recommend trying to learn from self advocates to hear it from their point of view. There's lots of professionals that have studied, and it's great to learn it at that level, but don't forget to learn it from the self advocates level, because that's highly important. They're the experts, right? And sharing some of the things that they feel and experience. Advocating for those self checks. So this is what I've been talking about a lot, but teaching how to check in with yourself and see how you're doing, and then asking for help. And then for you to start learning those times when they may need extra help. So, for example, I know with my youngest daughter, um, doctor's appointments are very tough for her because she's had some traumatic experiences while in office appointments. Um, so I um, make sure that I include some extra supports when she has these appointments. Um, I schedule them in late morning to make sure she has time to get through her routine and we don't have to rush. I talk to her about it the night before. I have a checklist ready of what she has to go through to get through the appointment. So, and then, check in with her and ask her, how are you feeling? Do you feel nervous? Do you feel worried? What do you need? And it's something she's still learning. She's 13 now, but, you just keep doing it until, one day you're surprised and that information just starts coming out independently. Advocate for medication. You know, medicine is not a bad thing. We just want to make sure that it's the appropriate for what that person needs. So, um, talk with the physicians and therapists about medication to kind of see what options are. And also the individual, right? We don't want to leave them out, but have those conversations about medication to try to learn what might be the appropriate ones for them. Um, and then, if it is a prescription that is prescribed, getting it and then taking those notes on how effective it is. So, how is the person feeling? What changes are you noticing? And most importantly, be patient. Um, this isn't easy. And there's a lot of stuff that happens and you just don't understand why. I don't think anybody really wakes up and feels like I just want to be difficult. I want to be problematic. But I do feel that so often, because we're human, we can kind of feel like certain things are being done just to get attention, or just to be manipulative. And I feel like that's not always the case. So I really try to remind everybody to be patient with the individuals, but then also with yourself, right? Recognize when you may need a break, recognize when you may need a different person on the team, and advocate for yourself in those areas, because that's another way of advocating for the individual. Um, if you get burnt out and get to the point where you're so frustrated that every interaction that you have with them is more of a negative, well, that's not helpful for them and it's not helpful for you. So being patient, recognizing that they're human and you're human, um, and sometimes we need to pull more people and resources into the team, and that is okay. So, as you may have noticed, I have re recorded this because the audio from when I presented this live at the conference didn't sound very clear. So, I have redone this um, presentation at my office so that you have a nice, clear explanation of the different slides. And when I did that presentation, I closed out with a case study like this one here on the screen. And I will give you a moment to read this. You can pause it. And then when you finish reading it, I want you to think about what is going on with Lucas, the young man in this case study, and what are some things that you feel were understood and not understood. So go ahead and read through, think about for a minute. You can pause while you do that. And then once you're finished, come back and I will share some of my thoughts. All right. So go ahead and read it. I'll see you in a second. All right. Did you pause and read it, or did you just cheat and just keep playing it because you want to hear the answer? So, and that's okay if you did, right? So, this is a case study about a 38-year-old man named Lucas who has a diagnosis of Down syndrome. He lives in a group home, and he's really like proud of his stuff and his property. He keeps his room pretty neat. He considers himself a ladies' man because he's always putting so much time into his appearance. Um, he likes to hang out. He lives with some other gentlemen in his group home, and they spend a lot of quality time together. Um, in the evenings by watching TV and doing games. And lately, things have been different, right? So it talks about how the new day staff and the night staff have been documenting that lately Lucas has been refusing to take a shower. He's been refusing to even change his clothes. He doesn't want to get his hair cut. So the new house manager, Shanice, calls mom to kind of talk about it. And mom immediately just says, you know what? He does this sometimes. Um, sometimes he gets manipulative and just wants everybody to do everything for him. And she says that a strategy that she uses is if he does not listen, that he just can't do whatever. He can't go on an outing um, as a punishment. And she explains that at the time the family is tied up helping the younger sister prepare for a wedding, and she can't come to visit. And um, because Lucas has been going through this change, he hasn't been as social as he usually is. So he hasn't been coming out of his room. And then over the weekend, he decided he didn't want to go bowling, even though the bowling was a birthday party for one of the housemates, Austin. And because he didn't want to go, and they were short staff at the group home and didn't have enough staff for one to stay at home with Lucas and the rest to go bowling, everybody had to stay home. And that really upset Austin. And because he was upset, he told the other two housemates to just ignore Lucas, right? So when we look at this, um, one of the things we noticed, or to me, one of the things that popped out, the biggest things, was that change in his hygiene. This is somebody who was known for always cleaning up after himself and taking pride in his appearance, and we see that that has changed. Um, Also, this is somebody who is very social, but now they are more isolated, right? And that's a concern to me. I also see that we have a new housemate manager, so we have a new staff. Um, and then when it comes to the family, I see the family seems to be pretty preoccupied because his younger sister is getting married. Um, so that's another thing that he's dealing with. And then while he's having a hard time, he inadvertently, you know, um, I guess messed up something that was important to a friend and a housemate, and as a result, that person's mad at him, and then the other two people were mad at him. Now, these are three individuals who he spends a lot of time with and he lives with, right? So now you have this tension in the house from this incident with the bowling party, and we also have mom stating that he's doing this to be manipulative. Now, from my experience, when this is said, it's often shared back with the staff, and then everybody kind of takes on this belief that the person's just being manipulative and, controlling, and they want all the attention. They may look at it as he was jealous of Austin and he wanted the birthday party, so that's why he sabotaged it. And it's not the case. I feel like this is a classic sign of somebody who also has depression, maybe some anxiety. As we see, it affects his hygiene, the way he takes care of his personal space, how he interacts with people. So, in this situation, rather than looking at it as him being manipulative and not listening, and then as a result preventing him from doing some of the things he enjoys, like going out, I think maybe we need to have a talk with him about his feelings and see what's going on. Possibly pull in his doctor to have a discussion about maybe some medications to help with these different feelings. And then I highly, highly recommend working with a therapist. One of the things that jumps out is that the family is all seems to be preoccupied to the point where they can't come and visit because they're getting prepared for his sister's wedding. And it's not just his sister, it's also his younger sister. And I have often um, had discussions with individuals in this situation and, have listened to their feelings of sadness, um, a little bit of jealousy, frustration, you know, related to a younger sibling having relationships and moving to the stage of marriage, or even, going off to college or getting their driver's license, having children. It's kind of like they're the older sibling and the younger sibling's life is continuing and theirs has kind of plateaued. And that's a lot of big feelings that are very valid to deal with. So, just kind of a brief discussion about this case study as a way to kind of provide a different point of view. This is something, again, unfortunately, I see often with working with different group homes where these different changes are just looked at as maladaptive or unwanted behaviors without looking at the why. So, I share this again to help bring awareness to the fact that there's always a why and that we need to address the why before we start addressing the behavior. So really looking into things and seeing what is leading to these changes. Why are you not, taking care of your body by doing your hygiene practices? Why are you not socializing with others? um, what caused these changes. And then if we can get a better understanding of that, I feel like we would be more successful with coming up with the right intervention or strategy to help them get back to that baseline. So just wanted to bring the awareness to the fact that people with IDD often have some kind of mental illness or mental health problem that they're dealing with as well, and that we need to take that into consideration and really start addressing the mental health problems um, and the mental illness when we see these different changes in how they interact with their environments, and not just write it off as a maladaptive behavior. So this actually was just an hour piece of a longer presentation that I provide on this topic. I actually have a series on this topic, and I hope that you enjoyed the information. If you have any questions, please do not hesitate to email me. I have my name, my email, my website, and then some of my social media accounts on this page. And I welcome you all to reach out, with any kind of questions. Check out different services and workshops coming up. I also have an online classroom that I'll be launching very, very soon with different presentations and coursework on topics like this and a lot of others. So, again, I thank you so much for joining me for this past hour. And I look forward to seeing you and working with you all in the future. And I also look forward to working together to continue to try to make a difference, bring more awareness to the IDD population, and improve the quality of life, promoting inclusion and acceptance for all. All right, take care. Bye bye.